I'm Dr. Shiva, one of the senior consultants, Obs and Gynae doctors at Medcare Women and Children Hospital, Dubai. Today, I have been asked to talk to you about fibroids and women's health. I'll be taking you through the various aspects, including what are fibroids, what are the different types of fibroids, what symptoms do they present with, and what treatment options do we have to offer you to relieve these symptoms. After that, and there will be a session of question and answers, and the questions will be taken by my marketing team, Miss Kimia, and I will try to, you can put in whatever questions and queries you have about fibroids, and I will try my best to clear in a very logical manner. And let me first start with what are fibroids. Fibroids are innocent tumors arising from the muscular and the fibrous tissue of the wall of the uterus. Why I picked up this topic is that because it's a common problem which reproductive age group women faces, and that means the woman aged between 20 and 50 years, and it affects almost 30 to 40% of these women. So coming to the types of fibroids. Fibroids can be, depends on the location of the fibroids on the uterus. They are basically divided as, which is seen inside the womb, lining of the womb, are called the submucous fibroid. And those which are out inside the wall of the uterus, they are intramural fibroids, and then fibroids which are outside the wall of the uterus are subserous fibroids. These are important, that's why I'm telling you, because it depends upon the location, the symptoms and the treatment differ. And then coming to the symptoms and signs. What are the signs and symptoms of fibroid? Fibroid can present with no symptoms, and it can be just an incidental finding when you do imaging, that means ultrasound or MRI for some other reason. Sometimes they can produce, if they are inside the lining of the womb, it can produce increased heavy menstrual flow during periods, and it can cause painful period, and also it can cause variety of urinary symptoms because of the pressure symptoms, because of the size of the fibroid is big. It can press on the urinary bladder or the water bag, and it can cause increased frequency of urination, or it can even cause retention of urine, which can come as an emergency. Then it also causes, it can press on the back passage, and it can cause constipation. So there are a lot of pressure symptoms also, and bleeding disorders also the fibroid can present with. So depending on, the next question is when you have to treat the fibroid. As a thumb rule, you have to treat fibroid when they are symptomatic, especially when the fibroid is inside the lining of the womb, which causes heavy bleeding and which can cause any problem with the implantation during pregnancy, causing miscarriages. This needs to be addressed. And fibroids in the outside the uterus and big fibroids which can cause pressure symptoms, because the urinary bladder or the water bag and the rectum or the back passage, it's very close to the uterus. So they can cause pressure effects on the kidney, and it can cause disorders in the kidney. And it can cause pressure effects on the rectum, and as I've told you before, it can cause constipation. So when the patient is having symptoms, definitely we need to address it. So what are the treatment options? We have treatment options, mainly medical. For any condition, there will be medical treatment options as well as surgical. So medical treatment options like hormones, some hormones like which are produced from the brain like GnRH, they can cause the shrinkage of the fibroids. So this can be given especially with big fibroids, and waiting for the surgery, it causes shrinkage and it makes the further surgery easy. And also when the patient is near the menopause, you can give this to avoid any unnecessary surgery. So what are the problems with fibroid? What are the problems with this type of treatment with GnRH or this type of hormone? Because it causes menopause-like symptoms like hot flashes, vaginal dryness, and mood changes. So we have to have a close discussion with a detailed discussion with the woman, and we have to take an informed consent to go forward with this treatment option. Other hormones, which is called, there are some female hormones like progesterone, which is having some receptors. So some hormones which act against these receptors, like it's commonly called esmaya or ulipristol. This is very commonly used in UK and other developed countries. But the problem with that, it can cause liver toxicity. So they are have a limited option nowadays. Yeah. Then comes the high frequency in ultrasound treatment called HIFU, but this is using high frequency ultrasound waves to treat the fibroid, but the limitation is that it is not useful for big fibroids. Maybe it's used for 3 centimeter, 4 centimeter fibroids. Then comes the uterine artery embolization. That means there are small particles we inject through a small tube or a catheter into the vessels which supply the fibroid and the uterus. And this causes the necrosis, or the blood supply will be cut, and it will be made to come as more pieces through which the woman will pass through the vagina. So what are the complications of this uterine artery embolization? This is not very acceptable because it is mostly used in people who have completed family, and also it can cause very stormy post-procedure period. That means the patients can present with fever and very severe pain, which may not be very acceptable. Then comes the surgical treatment. That is the mainstay of treatment, which is a very definitive treatment. You are going to remove the fibroid. Depending upon the position of the fibroid, as we discussed, if the fibroid is inside the lining of the womb, the woman has to undergo something called hysteroscopy or a camera test, wherein you can see the fibroids inside the lining of the womb, and we can remove it through various techniques. Then if the fibroid is in the wall of the uterus, or it is in the outside the uterus, we can do the removal of the fibroid through opening the tummy. That is, in olden days, we always open the tummy, and it's called laparotomy. You open the tummy and remove the fibroids. But it has got its own, demerits. Nowadays, the laparoscopy has really made a great advance in this field. That is keyhole surgery, wherein you enter the abdomen through small tiny holes like 0.5 centimeter or 1 centimeter, and then we can remove through special instruments, tiny instruments we pass, and we can see the inside of the uterus and the fibroids in the TV, and then you can operate it. We can remove the fibroids with good precision. Advanced laparoscopic skills are required for this type of surgery. Then depending on the this treatment, definitely we need to discuss with the woman, and we have to take a informed consent, discussing with the type of the side effects, or what are the implications. Everything we have to discuss in full detail with the woman, and definitely women should be involved in the decision making, and finally we have to take a decision to remove the fibroid through whichever route which I have mentioned. I think now I will ask Kimia to join me and take all your questions, and I will try to clear whatever possible in a very sensible way. Hi, Kimia.
Hi, doctor. How are you?
Yeah, I'm fine,
Thank
Kimia.
you so much for joining us
Thank
for this
you.
very important subject. I think fibroids are more common now than what they used to be before. From what I've heard.
Yeah, because it's basically, it is not that it was before also it was there, but the understanding of the fibroids and how the fibroids were detected, because a great advance in the ultrasound and the MRI and all the imaging techniques, the more fibroids are being diagnosed.
Okay.
Fibroids were there before also, but it was not diagnosed at that time.
With the advancement
in the imaging, more and more fibroids are being detected.
Okay. Doctor, my first question is, can fibroids cause clots coming out during menstruation or during periods?
Yes, the fibroids can cause, because when the fibroid is inside the lining of the womb, it all what it happens, it will do the increase in the surface area of the womb. So more and more bleeding will occur, and when the more bleeding, it can form clots.
Okay,
So
then
it can
that comes
cause
out.
clots and heavy bleeding.
Okay,
Yeah.
are you at a higher risk is it hereditary if my mother or my sister has fibroid? Is it
There is a familial tendency. If your sister or mother has fibroid, you have a tendency to have fibroids more.
okay?
And some of there are some areas or some geographic distribution, and in the Afro-Caribbean area, the fibroids are more.
Oh, really?
They have very big fibroids, and number of fibroids also very high.
Oh, really? Is it because
For
of
a
the
single
nutrition?
person.
Sorry.
The reason I don't know why it's seen like that, but we are finding it in our experience, huge fibroids. They tend to develop huge fibroids. Actually, last week I have had a big fibroid, almost 1.5 kilo fibroid,
Oh.
We have removed through the laparoscopy.
Oh, really?
Me and my team has removed, and it was really challenging, but we should have a very good advanced skills to do such surgery, because there are very important techniques, like how to reduce the bleeding with big fibroids. We can block the blood supply to the uterus, and through certain ligatures or sutures, or certain you can reduce the blood flow to the fibroid and the uterus by injecting certain medicines, and then we can remove the big fibroids with a limited blood loss.
Okay.
Yeah.
So when you say big, how big do you think, what are the biggest fibroids?
Yeah, as I told you, which I removed, it was 20 centimeter fibroid, and the maximum we have done is I have done with my team 2.5 kilo fibroids.
Wow,
Yeah. So, but there are many records. Fibroids up to 3.5 kilogram fibroids are removed by keyhole surgery.
Okay.
Yeah.
That's okay.
Yeah, it's
That's
really.
Good. Another question: do these fibroids turn into cancerous?
Yeah, they can turn, but they are only less than 1% of the patients. They have change into cancer.
Okay.
Yeah.
Okay. Another question is: does green tea have any effect on fibroid growth?
Yeah, it's a very interesting question, Kimia. Yeah. So yes, I have read many observational studies and evidence saying that green tea has some good effect in the growth of fibroid, because the green tea is having an antitoxic effect. Antioxidant effect, and also it is having anti-inflammatory effect, and it also reduces the anti-inflammatory effect of the estrogen or the female hormone, which causes increase in size of which has a tendency to increase the size of the fibroid. Usually these fibroids, they grow under the influence of female hormones. That is why after the menopause, they tend to shrink, because basically there is a decline in the female hormones after menopause.
Okay, they tend to shrink. Okay. Will fibroid affect fertility? Does it lead to infertility or a miscarriage or high risk pregnancy?
Yes, fibroid which is inside the lining of the womb, that can cause impairment in the implantation, or when the embryo gets attached to the uterus. When the fibroid is there, it makes that area not very healthy for implantation, and it can cause implantation failure, and it can cause miscarriages as well.
So do you recommend having a surgery to remove the fibroid?
Definitely. If you know the fibroids are there inside the cavity of the uterus, and we need to address that before getting pregnant.
Okay. So if somebody does get pregnant with fibroid, is that high risk, or how do you?
Yes, it is a high risk. Definitely it is a high risk, because there are certain specific complications which can occur because of the fibroid in pregnancy. Because fibroids can grow in pregnancy, because as I said, because the estrogens are more, or female hormones are more
Okay.
in pregnancy.
Okay.
So the fibroids can tend to grow big, and it can grow out of control, and then there can be, it goes out of control of the blood flow, blood supply, and it can cause degeneration called red degeneration. It can be very painful.
Okay.
Yeah,
It can
we have to admit the patient, give fluids, and give analgesics. Basically, we cannot remove the fibroids in pregnancy.
Okay. So when we say the word surgery, there are quite a few people who get a little bit scared. So is there any oral treatment that they can do for fibroids?
Yeah, that's what I mentioned, before, that there are some hormone treatments are there, but they have their own limitations.
Okay.
Yeah. But definitely some people want to avoid surgery. In such people, we have to give this hormone treatment, but they have their own limitations.
They have their limitations. Okay. Are there any other methods or modalities to tackle fibroids?
Yeah, there are, as I mentioned before, HIFU is high frequency ultrasound treatment, and then the uterine artery embolization, which will block the blood flow to the fibroids and the uterus by injecting small particles, which will block the blood vessels of the fibroid and the uterus.
Okay.
They have, as I mentioned before, they have their own side effects
Okay.
and concerns.
You also spoke about laparoscopy and keyhole. How large fibroids can be removed through those kind of methods?
Yeah, that's what we said, up to 3.54 kilos
Through
has been
laparoscopy?
removed through laparoscopy, and through open surgery, there are reports that they have removed 60 kilo fibroid.
60 kilo?
60 kilo, it's in a Guinness book. Yeah.
Oh, wow. Okay.
It's crazy, like.
Okay.
Yeah.
Wow, that's quite a heavy fibroid. How many fibroids can be removed at a time?
There is no limit to the number of fibroids removed, but it is cumbersome, to remove all fibroids. But maximum 30 to 40 fibroids, up to 50 fibroids have been removed. And what they advise, there is something called a string. You make because you may lose the fibroid inside after removing. You remove the fibroids and you have to retrieve them. You have to take them out. So what some of the surgeons have recommended, to put a string and you bead it, all the fibroids like a
chain.
Chain, sort of chain,
and then
so that we will not miss, because if you miss a fibroid, it has a tendency to get the blood supply from the neighboring bowel, and it can become parasitic fibroids. It's really a big problem. Yeah.
Oh, really?
Later it can cause the bowel obstruction, and all these issues can come. So you should be very prudent, to remove whatever you have removed. You have to take it out. Yeah. That's very, very important.
Okay. Should one go for a hysterectomy for fibroids after 45 years of age?
There is no hard and fast rule that, after 45 years, you have to take fibroids, but definitely you have to remove the uterus and the fibroids together. But definitely you need to discuss with the woman, and because as after she completes family, the role of uterus is, there is a limit, there is not much of a role, but you cannot take the decision for the patient. Some patients will be very attached to their uterus, they don't want to remove the womb, so in that case you have to really be sensitive, and you have to be sensitive and respect her views and ideas, and we have to address the matter like that. Sorry, I forgot to put the mask. Yeah.
Okay. That's fine, doctor. Okay, but do you as a doctor, do you recommend hysterectomy? If anybody would come, if a patient comes to you and talks to you about this, would you tell them to?
Yeah, I think, after 45, I would prefer to do a hysterectomy, because especially for big fibroids, and if there are multiple numbers, there will be a lot of blood loss, and also, it will be very cumbersome. Better than that, it's easy procedure to remove the fibroids along with the uterus.
Okay.
In those who have completed family. Yeah. But of course, you have to. Finally, the woman is the boss. They have to take the decision.
Yes.
Yeah.
Also, what are the benefits of a keyhole surgery versus a normal one?
Keyhole surgery has very good advantages over laparotomy or the open surgery. The early return to life and work, it's cost effective. The hospital stay is very limited, 1 or 2 days max, and the cosmetic, because it's a tiny cuts, so it's like a scarless surgery, than the big, 10 centimeter cut, and anyone would like to
have small tiny
tiny scars, it can be like after some time you will not be able to know that,
Oh, really?
scars will go away
Okay.
and you have a scarless surgery. Yeah.
Okay, that's good. Also, fibroids, does it help in weight loss?
Yeah, that's a good question. Yeah. But those, as I mentioned, fibroids weighing more than 2 to 3 kilos, of course, there will be reduction of 2 to 3 kilos.
Kilos. Oh, okay.
Yeah. But even otherwise, in my opinion, because fibroids, when they remove, even if it's a small fibroid which is causing heavy bleeding, you are removing and relieving the symptom from the woman. That woman, they will have the energy to focus on other physical activities, and which will indirectly help to lose the weight.
Okay.
Yeah.
So then that makes sense then. And what happens after a fibroid is removed? When
the fibroids are removed, 80 to 90% of the patients, they get good relief.
Okay.
And of course, when the fibroid is completely removed, the fibroid will not recur. That same fibroid will not recur.
Okay.
But new fibroids can sprout out.
They
can come back. And so in 5 years, those who had surgery, almost, like 20% of the patients, like that means 20 out of 100, they may have a second repeat surgery for a recurrence of the fibroid.
Okay. And I've heard of this term called myosure. What is myosure?
Yeah, myosure is it's a new type of special type of camera thing, hysteroscope, as I mentioned, which is having vacuum, and so it will retrieve all the specimens. The whatever we removed from it's mainly used for the fibroid inside the cavity of the uterus, and it will nibble the fibroid, little bit, and then you can retrieve that whatever removed piece by vacuum. So it's very, very useful. There are not only myosure, other products like TrueCut and many companies are coming up with this vacuum type of hysteroscope.
Okay. So you spoke about how the women feel really good once the fibroid is removed.
Yeah.
They have the energy.
Yeah.
How long after the fibroid surgery by a keyhole can a woman exercise?
Yeah, women can immediately after, they can start walking the same day, or the next day.
Really, that quick? Okay.
Yeah. And they can go for walking after 2 weeks, and strenuous exercise after 6 to 8 weeks.
They can do it. Okay. And how can I stop fibroids from growing back?
Yeah.
Is there any suggestions?
Suggestions, you have to basically do certain things you have to modify in your lifestyle.
Okay.
Like, for example, you can go for a Mediterranean type of food.
Okay.
What does it mean? Mediterranean type of food means, a lot of vegetables, green leafy vegetables, fruits, a lot of fluids, salads.
Okay.
And cereals.
Okay.
And food which contains, like more potassium, like banana, avocado, potatoes, tomatoes.
Okay.
All these are very good.
They're good
and
for this thing.
Those which contains more fiber.
Okay.
That will help to reduce the growth of the fibroid.
Okay. And finally, one last question. Are there any complications with the fibroid surgery?
As with any surgery, there are fibroid complications with the fibroid surgery also. Even with the keyhole surgery, it is a minimally invasive surgery. Doesn't mean that there will not be any complication. Okay. Because when you enter when you enter with the laparoscope, you can injure the surrounding areas like bowel. And during the surgery also, the neighboring organs can be damaged. But it's very, very not very significant, because they are not very common.
Okay, they're not. So
that's not common, and especially with those who are having good experience and advanced skills, the number of complications are also limited. Okay. But definitely there are complications and intraoperative bleeding. But there are techniques, how to tackle these things.
Okay. Before we close, any last words that you would want to tell our audience about fibroids? They should come and do it. Any, advice?
I think, generally, they definitely, if they have symptoms, definitely they will come. But my advice to the viewers is that, they should have a gynecology checkup at least annually, every year, so that, these things will not be undiagnosed.
Okay.
And then they will grow to big fibroids. And so that, they can be tackled at a less size and less number, and the complications will be less, and the impact on their life will be much better.
Okay. Anyways, thank you so much, Doctor, for joining us today. I'm sure the viewers would have benefited from this session. Thank you so much for being here with us.
Thank you, Kimia, for helping me in this session also. And thank you, viewers, for being with us today. And I am Dr. Shiva. I am consultant obstetrician and laparoscopic surgeon at Medcare Women and Children Hospital, Dubai. Thank you.